the idea that I have in my presentation, as you may have noticed in the title, we have culture, a line, and then psychiatry, and we have read it as culture and psychiatry. My working hypothesis is that culture is psychiatry, or we could reverse it, psychiatry is culture. And I hope my presentation can illustrate this point, and maybe we could discuss it. The context where I start is El Barrio, not far from here. Here we have an aerial vista of Philadelphia for the ones out of town and for the locals to feed their chauvinism. And the story is not as bright as what we saw before. It's in a space I like to call the box. It's not far from here, I would say by car, at most 5 minutes away. And they are under the elevated rails of the subway, the Market Frankfurt line. That's where the Latino community of Philadelphia survives. As you can see, life happens and the shadows between day and night often lit by electric light, and the only reminder of the existence of the sky is that metal rusty structure that is always dripping some inexplicable liquid that one doesn't want to ask what it is. Often I would catch one drop from it. So there, in this context, is where I discovered the Puerto Rican Syndrome. The Puerto Rican Syndrome may need to be again put in context because that box that I showed you before, maybe with an anecdote, will give you a little sense of the socio-economic context. This scene explains a surprise I had. One morning, early morning, I arrived at the clinic and I find a lot of light equipment, and my first naive assumption was, oh, gentrification is catching up with the barrio, so maybe other types of neighbors are moving in and the neighborhood is changing, perhaps improving. What I discovered in the excitement that surrounded this were the word Hollywood. So my question was, what did Hollywood have to do with urban renewal? In fact, they were filming a movie that maybe some of you have seen called 12 Monkeys. It's a post-apocalyptic scene. Life has been eradicated from the surface of Earth. Giraffes are ambling on top of this Schuylkill River, and people live underground because the surface of the Earth is toxic. And in order to have some scenes, you see only animals can survive: bears, giraffes, a lion around City Hall. What I took naively from a sign of cleanup of the neighborhood was that they needed to paint it over to make it look post-apocalyptic. That's the first realization. People would say, oh, Hollywood, the exaggerated, the end of the world cannot look that bad, so they have to make it look better. And the other, even more disquieting lesson from that is that in order to become visible, it needed to be painted over in white. It needed to be whitewashed. And this is one of the points, the invisibility of these social locations. So they are in the barrio, where the inner cities of what I discovered coming from the compassively cold thermal. I'm originally from Argentina. I discovered a reverse version of the American dream, because in the US we find a sort of third world within. This is sort of third world at home. And there I went from the third world to the third world. And we can make that travel anytime in Philadelphia. It's a 15 minutes car ride. We can go from Center City, from a very commercial, middle class, now it would be residential, and we can take one street and go through socio-linguistic islands with the collapse of the projects, and end up in North Philadelphia, where in the midst of the, walking not far from El Centro de Oro, where the sidewalks are painted in yellow to commemorate dreams of getting rich quickly in America, I discovered the Puerto Rican Syndrome. Another discovery I did before running into this strange label you may wonder, what was I doing there? I was a recent immigrant from Argentina. I found employment in a mental health clinic, and to my surprise, I realized that I was a minority within a minority, because I identify myself not just as a psychoanalyst, but also as a Lacanian psychoanalyst. And I had been trained with the formation in psychoanalysis, where there had been a long tradition of work in clinics, free clinics in public hospitals, and I was happily not biased by the prejudice of thinking that poor people cannot afford to have an unconscious. So because that's often the objection, poor people are not good candidates for psychoanalytic treatment, I wasn't aware of that, and I simply did what I had been trained to do, which was to listen to whatever came to mind. And there I found in the records mentions of the Puerto Rican Syndrome, which is a diagnosis that was coined in the 1950s among mostly Korean War veterans. The manifestations seems to be something like a sort of epileptic attack, at times outbursts of anger, but there couldn't be any organic correlate for the manifestations that were mostly triggered by stress. Coincidentally, this Puerto Rican syndrome, invented in the 50s, happens to be something that in not only Puerto Rican culture, but in many Latin American cultures, is called ataque de nervios, and is considered a normal, expectable reaction to situations of high stress, grief. It would be expected from somebody in a funeral to throw an attack, and people would come and just move a little page and try to comfort the person or pass alcohol in the body, and it will pass. What is interesting is when somebody has an ataque de nervios in New York, is immediately diagnosed as a severe psychosis. What is interesting with the story of ataques is that it's often associated with women. You may know that Almodovar found women on the verges of the nervous breakdown. But in the history of the Puerto Rican, it's not mujeres, it's not women, but courageous, macho soldiers who have been engaged in mostly very difficult, challenging war situations in an interesting historical context, because it was at the time when the Puerto Rican syndrome starts being diagnosed, it's just when Puerto Rico, which is one of the last surviving colonies in a post-colonial world, were allowed to have their own group after segregation had been eradicated from the military, with the exception of the Puerto Rican group, and they were able to carry the Puerto Rican flag together with the US flag. And as some historians have observed, in a way their position illustrates the contradictions of the colonial subject, of the subaltern subject, fighting for two contradictory powers and embodying two contradicting ideologies. I don't want to jump into the conclusion to say that the Puerto Rican syndrome is the same, is created by work by Korean veterans, or that all soldiers have Puerto Rican syndrome because of the war, but there is an interesting historical coincidence that one shouldn't disregard, because also from the presentations we heard before, the 50s were a very important decade in a very important transformation in psychiatry, with the introduction of anti-psychiatric medications and with the creation of the Bible of psychiatric diagnosis, the DSM. Interestingly enough, something disappeared with the creation of the first version of the DSM that is eliminated, which is the diagnosis of hysteria, and curiously enough, hysteric symptoms as those described in the history of hysteria, that according to some historians like Ilse Beth is the oldest surviving medical document, Papyrus Cajun, dating to 4,000 years, makes reference to hysteria, etymologically similarly associated with women, from the Greek hyster on uterus, but not absolutely. The way we understand hysteria, it has some relevance still today, has to do with the work of Charcot, which is at the bottom of the page there. Formidable Charcot, who was compared to Napoleon. Here you can see his posture there, and to his right is Freud. Hysteria has an importance for anybody interested in psychoanalysis because we could say that thanks to the beautiful hysterics, like Augustine on the upper right side, or these theatrical scenes that took place in La Salpêtrière in Paris, was when Freud studied with Charcot and discovered that there were these strange illnesses for which traditional medicine had no response, and happily Freud was humble enough to let himself be guided by his patients, and thanks to them, he discovered the unconscious and invented psychoanalysis. And if one looks carefully at the studies of hysteria, we see that Freud takes guidance from the patients. He used, for instance, to put pressure on the forehead, and patients would start talking, and some patients said, one in particular said, if you touch me, I cannot talk freely, so he decided that physical contact was not advisable. Another patient felt that having contact eye to eye was at times inhibited, so he suggested that to her to lie on the couch, and then words would come up more freely, and other material could emerge that otherwise could not have taken place. So we see that Freud, in a way, is taught by his patients and creates a method in collaboration. And this strange symptom find a treatment. Often it is thought that Freud worked only with upper class Viennese women who, according to some feminist readings, were in positions of oppression. Freud observed that anyone in a position of service, when his or her desire has to be put on hold, will develop hysteria or hysteric symptoms. There is an interesting chapter to which I will make reference in passing. This is a very good book by Elizabeth Danto, that she makes reference to a chapter that has been forgotten in the psychoanalytic history and often in the general history about psychoanalysis, which is the time of the free clinics. Between the two wars, Freud created a system in which most analysts were donating at least 1 hour a week of pro bono work, and the idea was to provide psychoanalysis for the masses, as Freud proposed in 1918. So with that background in mind, and having come from Latin America, where these have been practicing and continuously practicing, I found myself working under the influence of dangerous Freud, listening to the beautiful hysterics of the ghetto, who had an unconscious, even though they were not wealthy in other ways, and maybe putting the unconscious into work for people with 3 generations of unemployment, maybe to do something with their symptoms, was challenging certain repetition of social illness. I said before that I identify as a Lacanian, and as a Lacanian, I would say one famous dictum of Lacan is that the unconscious structure like a language, which is a way of speaking Freudian. Freud says that if we look closely to social psychology, individual psychology is at the same time social. So in a way, I felt that I was somehow prepared to deal with people who are placed in a very marginalized position. What would be best done for often the populations? I work in a mental health clinic, first as a staff psychologist, then as a clinical director. Often, in my experience, those type of patients are being treated like things and being told what to do, move from one clinic to another, often having treatments that last 30 years. And I would say that we shouldn't forget that Freud is the inventor of breath therapy. You will look at me with astonishment. There is a text of 1913 in which he apologizes, talking to an audience similar to today, an audience of medical students, and he's apologizing by saying psychoanalysis is a treatment that takes a lot of work and lasts a long, long time. At times we need 6 months of treatment, at most a year. So we could say that any treatment that lasts more than a year cannot be considered Freudian or psychoanalytic. That's why, in those times, sessions would be 5 times a week, because it would be considered a sort of intensive cure, like going into a sanatorium. So the idea would be intense and brief. So with all these ideas in mind, I believe that one can, and I won't want to advocate for psychoanalysis in every single mental health clinics in inner city, but that there is a certain political importance in allowing for people who are in a very disadvantageous social position to be respected and taken at their word, and to provide a space where we can listen to them, and what they say has value, and in the same way that one could argue that they get sick, that words can make people sick, words can heal, words can cure, in some situations words can kill, and we can reverse, and through talk therapy we could induce social change, already social change, by, we have been talking a lot about knowledge. What is the knowledge? In the psychoanalytic model, we would say that the knowledge lies in the unconscious of the analyst, and that knowledge will emerge in the work of analyst and analyst. And it's not that the analyst, of course, has undergone training and has undergone his or her own analysis, but in the moment, in the office, someone could operate as an analyst if someone else believes that that person is his or her analyst. So there we see already a change in the dynamics of power, that there need to be this, the patient needs to ascribe certain position to the analyst for the analysis to work, but the analyst does not believe it. We know that we don't know, that when a patient has a slip of the tongue and says knows, because he or she wants to say knows, K-N-O-W-S, in fact, thinking about the nose, N-O-S-E, we would not know that until the patient could, or a dream, will bring associations and render new meaning to something that always will come as a surprise. The unconscious always opens and closes, and is surprising to both. But it's interesting that often it's mentioned that when we work in, it was in my experience in inner city clinics, there is of course a social difference. Often the provider comes from the middle class, has a graduate school education. It is often the case, and I have been my experience here in North Philadelphia, I have worked with patients who were illiterate in English and Spanish. So we have a clear class difference and educational difference. But if the assumption is that there is a knowledge produced in the office that will be a production joint of the work of analysts and analysts, they have an interesting reversal of power dynamics, at least during the hour of the session, that hopefully could have effects elsewhere. So we would like to mention in passing, given this context of power dynamics, of the outstanding thing that the ataque de nervios, I will not elaborate a lot on the Puerto Rican Syndrome, as the name calls up, the fact that there is a Puerto Rican Syndrome for Puerto Rico, which is not an independent nation. There is no American anxiety or French melancholy, but there is in the psychiatric manual a diagnosis attached to nationality for a group that is not an independent nation. There we see politics, ideology, clinical problems all coming together. Why do we still talk about the ataque de nervios in the DSM? It's a cold warning, will be a red light to call our attention to the fact that diagnosis, which is a very important clinical tool, should not be used as a tool for segregation, and that's the danger. At times, and you may have experienced that in your clinical work, giving a diagnosis could appease, could help, could calm the anxiety of the practitioner, or could be helpful in some cases for the patient because it could have an effect of nomination. They don't know what's happening, they have a name for something that couldn't be expressed before. But we have to always be cautious that there could be alienating effects, and that one should be careful how we use diagnosis. At times, a diagnosis should be only a working hypothesis. I think we would work with the diagnosis and test during the treatment whether or not that hypothesis is true, and we may change our mind as the treatment progresses. Of course, we need to keep that in mind to see how we're going to intervene. But what I would like to say rapidly, and maybe if there is more you would like to discuss, I hope it will come in the discussion, is that one big danger that still persists in the DSM-5, because we have a glossary of cultural references. There is a glossary of otherness, because look carefully at the geopolitics of the countries that are listed as other is often non-industrialized, undeveloped countries. So we have syndromes from cultures. We, if we see we as Western or American culture, could be seen as other. And it's important who this other is. Curiously enough, Hispanics nowadays are the first minority. What does it mean first? It means the most numerous. And indeed, Hispanics are causing panic. And that they are no longer a minority, we may say. By 2050, they will be 1/3 of the US population. We heard the presentation this morning that we are transforming into another which is not such another after all. And what maybe I would like to conclude with is with the idea of when we talk about another, what is another? Often as a result of my experience, there is the golden block, you see the yellow sidewalks. The rest, the context of that is not as promising or as shiny as gold should be. Gold-paid dreams of getting rich quickly in America. What is more like the reality? Often I'm invited, since I had that experience working in North Philadelphia with Hispanic communities, to present how do you work psychoanalytically with poor people. And I always feel that I will disappoint the audience, because for me, I just work. And there is no way of working differently with poor people. That I think one should try to bracket off all our prejudice and just listen to another person in all the dignity of their suffering. And at times, in those discussions, I discovered one interesting allegory of what is the work of psychoanalysis. And we could say that maybe when Freud called the unconscious the other scene, the other kind of other scene that opens up when we fall asleep and start seeing strange things while we dream, that is the sort of undocumented immigrant we carry within. Our unconscious is the immigrant we have inside. And that hopefully the work of analysis will produce maybe a naturalized citizen, maybe, or at least a documented immigrant, a legal immigrant. And what we maybe need to keep in mind is that we should not work clinically as the border patrol. Thank you.